Hi, I'm Kimberly Knight, Director of the Caregiver Support Program at the Senior Source. And today I want to talk with you about something that comes up often for family caregivers: the important documents you need to have in place for your loved one. If you're a caregiver, you may have found yourself thinking, I wish I had known this sooner. These documents help you advocate, make informed decisions, reduce stress, and avoid scrambling during a crisis. I want to say this up front. This is not about getting everything perfect overnight. This is about being prepared, informed, and supported one step at a time. Let's start with medical information, because this is often what caregivers need most, especially during emergencies or medical appointments. First, it's important to have a complete list of your loved one's medical history and medications. This includes diagnosis, allergies, and both prescription and over-the-counter medications. Keeping this information updated can make a big difference when meeting with healthcare providers. Next, keep a list of all medical providers, including primary care physicians, specialists, dentists, and therapists, along with their contact information. You'll also want to include pharmacy information, including mail order pharmacies if your loved one uses them. Be sure all insurance information is organized and easy to access. This may include Medicare, Medicaid, supplemental insurance, and long-term care insurance. This will be extremely helpful when you have to speak on their behalf at a doctor's office. Now let's talk about some critical legal medical documents. A HIPAA authorization form allows healthcare providers to speak with you about your loved one's care. If you're not on their HIPAA documents, their doctors won't be able to legally talk with you, even in stressful situations. A durable power of attorney for healthcare designates someone to make medical decisions if your loved one is unable to do so for themselves. Along with that, a living will or a physician's directive outlines your loved one's wishes for medical care. And if it aligns with their wishes, an out-of-hospital do not resuscitate order or DNR should be completed and easily accessible. These documents help ensure your loved one's preferences are honored and that you can confidently advocate on their behalf. Section 2, Financial and Estate Documents. Let's talk about financial and estate documents. This area can feel overwhelming, but having this information organized can save time, reduce stress, and prevent confusion later. Start with a list of bank accounts and credit unions, including usernames and passwords if your loved one is comfortable sharing that information. You'll also want to know about any safe deposit boxes, including where they're located and who has the keys. Important property-related documents, including deeds to homes or land, rental agreements, and car titles. Be sure to gather information related to income retirement, such as 401ks, IRAs, annuities, pensions, and other investments. You'll also want copies of trust documents, your loved one's will, and financial power of attorney paperwork. Other important items to organize include insurance policies, tax records, a list of credit cards, and outstanding debts. Contact information for professionals such as attorneys, accountants, and insurance agents. If your loved one receives public benefits, it's helpful to track renewal or expiration dates. One especially helpful document is a letter of instruction. While it's not a legal document, it can include personal notes, preferences, and guidance your loved one wants you to have, often providing clarity for you and peace of mind. Section 3, Other Important Personal Documents. Finally, let's talk about other important personal documents that caregivers often need to access. These include birth certificates, marriage or divorce documents, and death certificates if applicable. Identification documents are also essential. Make sure you can access Social Security cards, state-issued IDs, passports, citizenship papers, Veterans ID, if applicable. If your loved one has already made burial or funeral arrangements, keep that information in a safe and known location. Having these wishes can be a tremendous gift to both your family and to you. I know this is a lot of information, and it's completely okay if you don't have everything in place yet. Being a caregiver is already a full-time responsibility. My encouragement to you is this: start with one category, one conversation, one document at a time. Even small steps can bring clarity and peace of mind. And remember, you don't have to do this alone. If you need help organizing documents or understanding what applies to your situation, support is available at the Senior Source. We're here to help caregivers navigate these important conversations and decisions. Thank you for all that you do as a caregiver and for taking a step toward being prepared and empowered. Until next time, continue to be a confident caregiver.